Okay, welcome to episode 1 of PrevMed Conversations, where we talk about the future of preventive health in Africa. I'm joined today by the visionary behind PrevMed. This is Dr. M, officially, Dr. Tshegofatso Maimela, who's redefining how we really think about well-being and healthcare. Dr. M, it's very wonderful to have you here today. Thank you for joining us.
Thank you so much, Sakwadi, for the wonderful introduction. So I'm not the only visionary in the team. So I have a business partner and a co-founder who has helped me shape the whole PrevMed journey. Dr. Volmink. And in fact, he's the brains behind the more precision science part of it. And we've got another partner, of course, who does the business science part, Mr. Rajkumar. So yeah, I'm happy to be here, and I'm happy to talk about PrevMed, talk about preventive medicine, also in as an umbrella area of practice. An emerging field that is very exciting in my view, and I think well-timed in our context. So let's have the conversation, and I'll answer where I can.
Of course. Thank you for the lovely intro, Dr. M. Let's actually narrow down to your why. What is it that inspired you to move from clinical medicine to preventive and lifestyle medicine?
So interestingly enough, my lifestyle medicine journey started actually, I think around 6th year of medical school. A colleague of mine, a very close friend of mine, Dr. Gule, and I and a couple of other colleagues started thinking about, lifestyle medicine, and we were seeing already, I think, in our undergrad qualification that we wanted to have a very personal relationship with our with our patients, and everything just sort of seemed quite curative, and it ended up being exactly as we thought in practice. Everything is reactionary in the health system at the moment. And I think we, by and large, globally have created a disease management framework rather than a health and longevity well-being framework in healthcare service and healthcare management. And so back then is when it started, but of course there was internship, community service. We couldn't really get the dream going. Dr. Gula ended up starting a wonderful enterprise called MediSpace, and she had a lifestyle institute that ended up, doing really great work in both the retail space and in the corporate space. And part of that vision of that enterprise lifestyle MediSpace Lifestyle Institute was to actually do a lot of lifestyle medicine accompanying the traditional, pharmacotherapy wherever we saw fit, and the bug has never left me. So in as much as my work took me a little bit tangentially through the population medicine approach, which is where the statistics now made me really want to do something about the growing and looming crisis that we have in terms of non-communicable disease statistics globally. And in public health, we commonly frame interventions in terms of levels of prevention. So are we preventing somebody from initially getting the condition? Are we preventing any complications related to or disease progression once we found that there is a condition of concern? Are we preventing death? Are we reversing disability? And so those levels of prevention inspired the thought that, preventive medicine can exist in its own clinical domain, making sure that we reframe health systems from curative mostly to a combination, certainly, of prevention and curative, and also allow for patients and communities to have a little bit more agency of what happens in terms of disease progression or risk. And yeah, I think the public health eye has helped me just sort of articulate where preventive medicine sits in the ecosystem. And my why is because, well, clinical medicine is a part of who I am, and I love seeing patients. I love creating programs that are meaningful. And with the advent of lifestyle medicine specifically, and precision medicine, and other preventive models, integrative and functional medicine also are in sort of this umbrella. I think those modalities have become far more evidence-based. There's a lot of publications coming out around the ways in which we can structure lifestyle methodologies and lifestyle pillars to improve health and outcomes. And of course, to empower patients so that they aren't solely relying on the pharmacotherapy, although it does have its place in patient care.
That's very inspiring, Dr. M. I think I really enjoy how your motivation is really sourced and anchored by just driving change and transformation. And this really drives into then my next question of whether or not there was ever a moment, even a patient story or a personal realization, that made you realize that something had to change, something had to transform and become different.
Yeah, I think, sure, I can't place one. There's so many stories. Of, I mean, if I just look at the conversation currently in relation to the kind of burden that facilities have to take on in treating what is mostly preventable. So, people are arriving at facilities with disease and disease that's already progressed to the severity that they require either admission or specialist care. And I think with a global economy that really can't stretch to meet that kind of trajectory of a disease burden, we really need to shift towards prevention. And just thinking about the economics of it, of course, the growing disease burden of like diabetes, hypertension, which is quite prevalent certainly in South Africa and in the continent. Certainly with the globalization, taking its effect into our communities, our diet, our sedentary lifestyle, and just seeing the number of people who then become so sick that they can't work, or just the degree to which the health system is stretched. We can't keep up with producing the number of healthcare workers to meet the demand at the rate that the demand is increasing. So there are quite a few factors that are already showing a system that is really, really overstretched. And so in as much as this kind of intervention is the obvious solve, it takes some time, obviously, to reframe the way we've approached healthcare delivery. And yeah, there are too many cases to name. One of the other issues that I've gotten particularly curious about and passionate about is trying to deal with the fragmentation of care that currently exists. So you'll find quite a few of our patients or communities having maybe many conditions. And if they require more than one practitioner, it's still a fragmented, they have to sort of figure out the ecosystem for themselves. And sometimes they may have conflicting recommendations and nobody sort of crystallizes it. And I know maybe people are going to ChatGPT to find out what's the next best thing, but ideally you want to be having an engagement with, or a stratifying process with someone who understands what your health goals are, appreciates the pharmacotherapy and the multiple caregivers that are part of your healthcare journey, but sort of crystallizes it. And that's really what we want to do, make being healthy simple and sustainable. And prevention is really a more sustainable approach than layering on curative, and a lot more intervention. So that's really that's the whole ecosystem has geared me towards placing a little bit more effort in this area. And consolidating the thought, not only in private sector through the likes of a program that PrevMed would be championing, but certainly how that would also translate in public sector where the majority of our people access care.
That's very important work. I think with the economical bits that you did mention, now really is the time to rather invest in something that will prevent you from spending like an excess amount of money in the future, as opposed to letting go of that bit and choosing to worry about it at a later time.
Right.
Yeah. So you definitely often talk about the gap then that exists between treating disease and building health. Can you maybe share more insights about what this means to you?
So I think health is a continuum, right? If you think about a person's life from birth to the grave, there are many things that happen. You're learning, you're growing, you're experiencing the world. You go into a schooling environment, you go into a workplace environment. You may choose to have a family, start your own family. And throughout that entire continuum, the goal is to remain healthy, to enjoy life, as it comes. The problem is that the way we framed health and health service delivery is that you meet the healthcare system when something is wrong, rather than to incorporate it into your whole life continuum. So what preventive health means to me, and health in general, is the invitation of health and well-being. We often speak about, when we're teaching some of our students in public health, certainly that the WHO describes or defines health as not just the absence of disease, but all these modalities of health and well-being, which is physical, emotional, psychological, social, and even spiritual. And just thinking about that definition, I feel like we've still just sort of stuck to the disease management part and haven't really expanded our practice to encompass this incredible definition of health. And so my interest is to see how we can actually expand in practice our engagement with communities, with people, with their families, with their workspaces, on how to create that invitation, that symbiotic movement back and forth around health and well-being, so that you get the most out of your workplace, so that you get the most out of family life, so that you get the most out of social life. and your own sort of self-actualization. Maybe it's a very esoteric thinking, very, philosophical in my approach, but I just think everybody should get a chance at it, where we can make it happen.
Mm. Lovely, Dr. M. I really enjoy how it really sounds like you are heading towards a direction that just generally aims to optimize health and well-being, right?
Mm.
And I think it then allows us to talk a bit then about PrevMed,
Yeah.
um, as, you know, a holistic, thing that it is that you are pursuing and working towards, right? So
Yeah.
how is it that you would then describe PrevMed in your own words?
So PrevMed is a company that Heinrich and I co-founded and invited narration to, um, because we see an opportunity to really make the scope of practice quite pronounced. The company is interested in implementing programs and approaches, I suppose, to an individual, even family, and even a corporate space, I suppose, um, to try and bring in not just the preventive care in the lifestyle methodology. So we have two arms to our science. First is the intervention, which is a health plan that is embedded within lifestyle medicine science. Lifestyle medicine science being about a decade or two, quite formalized, certainly in the global north, and making its self visible and growing in scale in the continent. And what it looks at particularly are 6 pillars related to health and well-being. Nutrition, fitness, which everybody sort of knows about generally, and there's a very strong industry related to that. But there are inclusions of other pillars, which are stress management, which obviously leads to a whole cascade of issues and difficulty for your own physiology to just get back to baseline. Sleep also being another pillar that contributes to that. Then there's reduction of harmful substances. That would obviously be external substances such as alcohol or other drug use. And then, of course, the last pillar is social connection, because social isolation actually is quite detrimental to health. And which is why, having moved from, community-based to more nuclear families and even just isolation in general, these have an impact on longevity. All of this is evidence-based. So that's the lifestyle sciences. But what we want to do and have introduced through PrevMed specifically, conceptually, is to have your blueprint from your genomic profile inform what we rank first, second, third in terms of your health goals. And the program runs, the programs that we devise individually or for a family unit is to go over 6 months saying, okay, here's your genomic profile. These are the issues that are coming up in terms of just your inherent risks. And with the genomics, we know that the risk doesn't necessarily mean it's going to happen, but we are aware of the risk. It gives the patient or the client a lot more insight, awareness, and they can engage with that report for life because your genomics are your genomics, right? And the aim is to obviously, test for things that we can do something about. We don't necessarily invest in testing for things we can do nothing about because that thing becomes a little bit demoralizing. What we want to do is, see whether or not certain expressions allow for us to frame these lifestyle pillars in a way that we can use. We also look at the genomics also look at your ability to metabolize certain drugs. So if you are already on treatment for anything, we get to have a look at whether or not it's actually the dose is appropriate for your needs and your ability to metabolize. So if you metabolize too quickly, it's easier to rather increase the dose so that you get that therapeutic range. And then if you metabolize slowly, we want to reduce the risk of side effects because you're breaking down the drug a little bit slower. And so we would recommend reduction. And so we do that across all the different profiles of drugs. We also see if there are any potential conflicts in prescriptions with that pharmacogenomics assessment. And so we have this full view of an individual. Commonly, we're seeing, people in their productive years coming through, and also trying to optimize the latter half of adult life. And so these insights are meaningful. Obviously, people are accessing over-the-counter drugs. They are accessing nutraceuticals, and so we also bring that conversation into the plan. And then we allow for people to go ahead and implement that with their healthcare providers, who they have trusted for some time, and we only come in to really just optimize their vitality, their sense of health and well-being.
Wow, I think it's very impressive how PrevMed sounds to just aim to go about things very sustainably. And I think in this world where there's like such a fixation on like quick fixes and almost finding what works now, forgetting about the implications that might be integrated into that later. I really enjoy how sustainable the pillars that it is you plan to integrate into PrevMed are, and also just like inherently the process that goes into this thing in terms of using genomics, something that will be like a forever template, something someone can use as reference forever, for life, because it's never changing. So let's talk more about then this program by PrevMed. How does it work? How does one go about the program? How long is it? How would you guide someone through this program?
So obviously, with the bulk of the work is right at the beginning with the assessment, and sort of profiling, and mapping out what's happening within the body and health goals. We partner with another a company to assist us to collect the more biological, physiological baseline, and we try and improve that baseline informed by this assessment. So the bulk of the work is the assessment. And then what we do is we have a conversation collaboratively with our clients to say, okay, this is the base of the program. These are the pillars. And based on the outputs that we've gotten from these two assessments, we determine that the top 2 or the top 3 items we need to tackle in the next 6 months are these. And how do we identify what is appropriate? We have to have a give and take with the client. Trying to understand, obviously, the ability for the environment to accommodate some of these changes. If there are partners, we invite the partners to come in and be part of the solution, part of the support structure. And the idea is for us to iteratively come back, check that physiological baseline. Is it improving? Is it not? Is our sleep improving? Is our sense of anxiety or stress reducing? Are we seeing gains in nutrition and in weight management and in movement, consistent movement, and the right kind of movement for your setup? Are you able to do some movement even if you have an office-based work? So we talk very in-depthly about what is it that needs to happen practically, and then what step 1 is all the way up to step 10, let's say, over 3 months, and then over 6 months, we do check in as frequently as possible in the beginning to sort of make sure that those are happening. Though that check-in is not necessarily a consultation or anything like that. Yeah, and so we just try and create a supportive environment for those habits to take hold. And once they do, and the benefits are really felt, it's difficult to let go of a good thing. So we try and just keep stacking it, and maybe inviting more people who are in the house into the program, because then it makes it far more sustainable. If the whole family is on something that is designed to keep health a core value within the family or within the workplace.
It sounds very beautifully integrated, and I think the question on everyone's minds at this point would then be who this program is designed for, and I guess who is it that qualifies for this, and how do you go then about this, and what kind of results can then whoever prospectively wants to join the program expect, you know?
Yeah, I think anyone can really join. Having a sense or an objective awareness of where you are in your health profile, and even inviting a conversation about where are the blind spots that I haven't even thought to look at, which the genomics often pick up. Helps just sort of say, okay, then in terms of health goals, they're not just general. We create this personalized strategy that is about you, about your goals within the environment and capabilities or capacity that you have. So it really is for anyone. And if the family is also considering a whole thing, I think it's beneficial for everyone to sort of have this assessment. And adopt healthy habits as early on as possible. And the sooner you get cracking, the more likely the momentum is going to grow over time, and you'll see those benefits. And so it really is for everyone. And of course, if we do identify any material risk requiring support from the broader ecosystem, we do refer out to our clinician network and to colleagues who are in the space. Certainly, if ongoing coaching intervention is required, we reach out to our community with lifestyle medicine colleagues and so forth. So, and then of course, if we need, to identify a specialist, we'll find the people. We've got a network of doctors and other health professionals who we can refer to support that whole program, especially if the gains are either slow or difficult, or of course, if there's a material clinical disease issue that we know is beyond a preventive, only a preventive perspective.
I can't help then but to think about then the scientific and philosophical aspect of PrevMed. You've mentioned that PrevMed combines genomics, biometrics, and lifestyle medicine. How do these elements then come together in practice?
So, genomics and lifestyle medicine, all are sort of housed under the umbrella, I think, of preventive medicine. All of them are used to get insights. Well, there's certainly the precision, and then just a general lifestyle assessment also gives you insight of what risks are there, So the idea is to use these particular scientific methodologies to inform where we are in the preventive ladder. So is it primary prevention? Is it secondary? Is it tertiary prevention? And what are we able to do? So some people, in terms of let's say cholesterol, are already on treatment, and so all we're doing really is to optimize the body so that we limit any outcomes in terms of cardiovascular events, heart events, or anything around the lines, stroke or things like that. However, they could be, so they could have something like that, and then we could identify another risk that we can, okay, fine, the risk is there, but doesn't seem to have created a condition. And so what can we do to optimize, in which case we are doing a primary preventive process to make sure that the person doesn't really ever get an expression of that disease, even though there is some risk. And so those two, so the preventive model also allows us to know where to stack what our intervention is, having seen your profile. And then the lifestyle methodology is the intervention that is sustainable, which you can carry outside of us, really, and take that ownership of your health and well-being, especially when the habits have been embedded in your daily life flow and your workflow and your home flows. And then you can continue to grow. And if there's something else you want to maybe look at, your profile is there. There's no need to do another one, but we can have another approach to a new goal that you're looking to undertake.
A key thing that you're mentioning in this current response is just continuity, right? And just the continuous progression of health. And there's currently a lot of talk globally about longevity medicine. How does PrevMed align with or differ from this trend?
I think so. What's interesting is longevity medicine has traditionally maybe looked a lot at the aesthetics, which is a good thing. Having good skin, looking good, feeling good, right? It's grown to encompass like a broader concept around not only looking aged physically, but your body also behaving in a age category that's beyond your actual chronological age. And the idea is what kind of vitamins, for example, practices, hydration, for example, is a longevity solution. You're well hydrated, your physiology works well when you're hydrated, you sleep well, all sorts of things happen when you are hydrated. Your skin looks great. You don't eat a lot more because you're hydrated. Sometimes we think that hunger is hunger when it's just thirst, and so hydration can also improve nutritional practices. So it's everything that helps us age well, and not at a rapid pace. So, for example, recent publications are talking about how if you have a chronic inflammatory state in your body, or you're prone to a lot of inflammation, that increases your risk of conditions such as pre-diabetes, etc., and they increase your risk of aging quickly. And so the idea of identifying these markers so that you can either reverse that aging process, improve your physiological age, your biological age, and see some gains in the way you age. But aging isn't just about what you look like. It's how you move in the world. It's whether or not you're able to, if you are planning on having grandchildren, are able to play with your grandchildren. You need energy to run around after toddlers. It's about thinking about, in the later stages of life, how do I want to be living? How do I want to be enjoying my pension, having worked like 40 odd years, putting away money? You don't want to be sick at the end of that 40 years or 50 years. So the whole longevity perspective has grown momentum because people actually want to live not only full and full lives, but quality life in those years. And so the idea of longevity medicine is to optimize the quality of that life with practices that make aging not a disease.
Mm.
Yeah.
Mm. I think having had my eye on PrevMed for a bit and like just following you guys' story, you often mention that prevention isn't just medicine, but it's legacy. Can you unpack what this philosophy means for you with us?
Yeah, so prevention is legacy, I think. In many ways. It's physical, like obviously it's your so if you live within a community, if you live within a family structure, um, you often learn habits based on the people who are around you. And if you have children, you are able to teach them something. You're
Mm.
giving them an inheritance of health and well-being because of the way you practice, the way you eat, the way you move, the way you safeguard sleep, the way you implement stress management, conversations, talks, you name it, within your ecosystem. And even if it's a friendship group, that is all part of health and well-being. But of course, the healthier you are, the more you can, be adventurous in life, do things that you otherwise wouldn't be doing. Um,
Mm.
and who knows, you could discover a talent or a passion, that when you're healthy, your mind is right, your body is right, you can pursue without any barriers imposed by your health.
Mm.
And that builds a legacy in terms of community. You could contribute something meaningful in that passion that outlives you, and that's the goal, really, to impact society as well as possible, as meaningfully as possible, and that's a legacy we hope not only the business does for itself, but that we do through the lives that we change, that the lives that we impact, the lives that are transformed through this
Mm.
particular mind frame and perspective that we bring to the health ecosystem.
Mm. It's very, very intentional work, Dr. M. I think we should dive a bit more then into the systems and impact of PrevMed. Beyond individual clients, PrevMed also works with clinicians, right?
Mm.
How do you then envision this ecosystem supporting doctors and healthcare systems?
Man, if oh my word, and I think this is something that I got from the lifestyle medicine community is,
Mm.
mm, you know, if all doctors were practicing well, living according to those pillars, right? I mean, the environment is quite taxing. The hours are difficult, certainly.
Mm.
A 24-hour service is being called for emergencies, you name it. The environment has its challenges and it imposes a lot of environmental risk to health. And I remember in my, I don't know, my internship years, comsov years, those calls, you're living on Coca-Cola and bawans to keep you awake
Mm.
um, overnight, because I mean, and then there's a sleep issue, so your circadian rhythm gets messed up a little bit. Man, my dream would be to have this kind of program geared at all healthcare workers, not just the doctors, every single clinician, the nurses, the backbone of our healthcare system, for them to be cared for. And I think it would be beautiful to see that the reception of that care translated into the broader health system. I mean, that's just a dream. Hopefully we'll
Mm.
grow well enough for those sort of interventions to happen. I think our healthcare workers have been through globally a significant amount of pressure, certainly for following that COVID pandemic.
Mm.
Some of the sequelae and consequences of that we're dealing with even today, and having to catch up on some of the gains that were lost in the health system because of that interruption in care. And so, yeah, I mean, I certainly see that. But I also see the system appreciating where preventive medicine actually sits and its complementary function to everyday practice. And that more of our colleagues, clients would access programs such as this. Really, PrevMed isn't the only preventive, business out there, but that they would actually optimize on what is available in the market. The sooner people start engaging and not being afraid of knowing what's happening with health, the more conversation, the more empowered our clients are, our patients are, for the clinicians who we refer to, the better. I think you get better outcomes, you get better collaboration, and you always need collaboration with your clients, because most of the work is done in the spots where you can't see. I mean, 30 minutes an hour is a little bit every day changes depend on that collaboration, that support and motivation, that they have somebody really supporting their growth in this health space, so in the preventive space, or even reversing disease. And I think it's possible. Interestingly enough, this week, I think I read that so when you have a condition, we allocate a code to it so that the billing system will know what it is that you've addressed. And in the lifestyle medicine community, we've celebrated the fact that there's a code for remission of diabetes, the remission, so removing diabetes from active, disease to it used to be called pre-diabetes, but you can move somebody on who is diabetic to a remission with lifestyle methodology as well as with pharmacotherapy. So yeah, I mean, there's exciting things that are in the system, and I think the more our colleagues know that this is where globally we're sort of trying to re-steer the wave of non-communicable disease towards remission, recovery, rehabilitation, all of that, I think might also sort of provide a little bit more breathing room for our clinicians, so that they can have more in-depth time instead of sort of going on this hamster wheel that currently they are. But I certainly wish I could just put them on the program. I think they would benefit.
No, I think a very important aspect of driving very impactful change is it coming from a relatable place, And I love the fact that you're then really relating your story and reason for change to your own years of depending on these very unhealthy habits to make it through. And I think that's it's a very relatable and real thing that happens. I think all of us can think back on a time where we had to survive off of very just unhealthy means to make it through, and you even having it in you to think about the people who you experience this thing with and people who are currently living this thing day to day, is
Yeah.
it's very commendable, very, very commendable. Which then brings me to this question of then what kind of long-term impact are you then hoping to make? Not just for patients, but for South Africa's health landscape.
Yeah. So for patients, is patients' outcomes, client outcomes, community health outcomes, like populations at a time. That's the first thing. For South Africa's landscape, I'm hoping that we really start supporting this idea of I know we have this NHI, which is a lot. It's very highly topical conversation. But one of its goals is to also, support this re-engineering of health from curative services to preventive services. And so I'm hoping to be part of the people who are thinking about the how. How does it happen? Like, how does prevention work? How do we make something as economical? Something as economical as physical activity and nutrition and just sleep hygiene accessible and make that a meaningful implementation for people, workplaces, families, communities, so that they can improve. And I think part of it is just to be part of the solution. I want to throw out innovation that supports the idea of universal health access, but certainly health promotion, health prevention. Those are areas that we haven't quite defined, even in the legislature. In terms of how does that look in practice? How does group sessions look? How do you treat a whole group of people? Currently, you're just dealing with one. How do you start thinking around that? And is that more sustainable economically for individuals, for families or teams, and certainly for the health system, for medical aids? So is it sustainable for the public sector? But then, generating evidence towards that. So that would be my interest in the long-term South African landscape. Hopefully for the model to be adopted also in African context, because we are a low resource, low country, and so having sustainable economical solutions, lifestyle medicine is there. I mean, the pillars are very simple, not easy, certainly with the kind of environment, the digital environment that we've got, with so many things coming at us. It's not easy to have this sort of, but I think it's sustainable and they're simple. And if you keep at them, you can create an environment where they are adopted.
You've spoken about then the economic cost of preventable disease. How does this then program create both health and financial sustainability?
Yeah. So from a health systems, I mean, let me think. Just say, you're only seeing somebody twice a year to assess your, right? That's twice you're engaging with the health system. If you do it earlier on, the likelihood is you're not going to engage with the health system until, your geriatric years, which is the goal really in longevity. But also, I think what this does is, with the care coordination across the clinicians, it allows us to share, the conversation between a multidisciplinary platform that reduces costs to individuals, having to do multiple things, the same thing in multiple spaces. I think that's also an economic burden that sometimes even medical aides have to take on, because, we're not talking to one another. Data sharing for obviously continuity of care, both up and across, and and outcomes as well, because you also, as a clinician, you want to know that your contribution has impacted in the well-being of somebody. I think societally, healthy populations are productive populations. Healthy populations, think about the long term together. They want to see, a more sustainable landscape. And I think that also is something that we don't really talk about, the societal impact of prevention. And certainly from a health system, reducing readmissions, unplanned readmissions, and having healthier communities that work together, that network together, that grow together. Man, maybe it's a beautiful South Africa in my head, like a really cohesive, well-working South Africa together, because we've got healthy minds, healthy bodies, healthy spiritual alignment, and societal values and goals.
That's beautiful, Dr. M. Thank you for that coverage. You have recently launched a crowdfunding campaign for PrevMed, which has been distributed across your platforms. Biggest congratulations on the launch of this campaign. We can only hope it soars to the heights that it deserves. But let's talk more about what it is that inspired this decision of launching the campaign, and tell us more about it.
So one of the one of the difficulties about trying to, prevention is a whole umbrella, right? You want to find people as early as possible, and not at the tail end of conditions, right? And so the objective of trying to fundraise is to create a digital platform that allows us to access and move through the assessment phase a lot quicker than we currently are. Yeah, the intention is to build the digital backbone of the program, making the data obviously easily accessible to across the different clinicians, as well as the patient. They own the data, it's theirs, it's their body, it's their information. And so, yeah, the intention is to really create a platform that allows us to speak through the platform to the clinicians, to create that collaborative environment, and to have throughput and referrals happening as effectively as possible. Yeah. And to find the right partners to come in and bring in that support, because there are already a lot of great digital solutions. We don't want to reinvent the wheel, but certainly in the context of how we're trying to create that synergy, that care continuum, yeah, that's literally the goal.
And what will these funds from this crowdfunding campaign make possible? I think both in terms of expanding access and advancing the platform.
So the long term is, of course, for us to start seeing more and more clients and putting them all on a plan, with their own blueprint that they appreciate and they understand. And for them to also refer other colleagues, other people within their net or within their community and their networks, their workspaces, etc., to do so. And I think the funds will help us just create a platform that is agile, that is intuitive, and that is able to keep that conversation happening. Our check-ins are currently WhatsApp-based, and we want to make it a little bit more structured in an environment that allows us to have calls that are within the platform, for example. Things like that, something, technically like that. But yeah, we do what we can with what we've got. We're still in the early stages, sort of second year of being around. And yeah, so I think that would be helpful. The program is very clear. Our patient journey is quite, predictable. It's just that we want to just speed things a little bit more and have a little bit more responsiveness through the platform that we hope to build with the money raised.
And for someone who's then listening in right now, why should they even consider contributing to the campaign and sharing this campaign?
My first assumption is that I think most of us want to see something different in the health system, I think. And I think PrevMed is suggesting something different. More agency, more awareness, more self-directed, collaborative care. And to see if we can move the needle a little bit, or a lot, hopefully, from the reactive nature of healthcare to that invitation that I spoke about, inviting health into the journey, into your own life journey. Seeing health as a partner to your goals, to your evolution, your personal evolution, your professional evolution. That's what we're trying to bring into the ecosystem with this. It's very formalized and technical. It obviously has to have science behind it. But yes, if people, there's never a right time to invite health. The sooner we do it, the better. The more you engage with it, the better. yeah, and the more collaborative we make the process, I think the better the gains will be personally, and with the community, societal impact, and that's the hope that would do that. Yeah.
Mm. As then we come to a closing and wrap up, what then would you want the message that it is you'd want to leave the viewers with about their own health and I guess about the future of preventive medicine?
Um, I'd like the audience to just know that there are many clinicians, I think, in the ecosystem who are really keen to partner with them in their journey of health and longevity. And that there are platforms such as these and clinicians such as ours who really want to make sure that they find you wherever you're at in your health profile, your health journey, your biological age, your physiological ability, and yeah, be that partner that helps you achieve your health goals without being too prescriptive, without being too overbearing, but allowing you to steer your health journey as much on your terms. The degree to which you implement these particular pillars is entirely up to you.
Mm,
The gains you are able to track. We've got wearables. Everybody's wearing, all these things. They can track the impact of that. But to make being healthy and well a real value for themselves, for their families, for their workplaces, so that they can enjoy these spaces and grow
mm,
and evolve in these spaces.
mm,
Yeah, I think the invitation is there. We're just hoping that as we grow, we find each other and we contribute to people's health and
mm,
well-being.
mm. Beautiful. And finally, can't believe we made it to the end already. But where then can people find you and learn more about PrevMed's brain and heart health program?
So you can find our website, PrevMed Inc, PrevMedinck.com. There's if you're interested in joining the program, you can put your details and we'll follow up there. We also have quite a few social media platforms. You can find PrevMed Inc. on LinkedIn, on Instagram, Facebook, TikTok, where we share some of the thoughts and approaches through a lot of video content. And then, of course, if there are any questions particularly to us, you can contact us at info@prevmedinc.com, and our team will come and support whatever questions you have. And then, of course, the Thunder Fund link we attach to as much of our content as possible. We only have about 58 days left, so we're hoping to make a push there between now and then with our ask. And yeah, that's how you can find us.
Lovely. Thank you so much for joining us, Dr. M. I'm
Thanks.
certain we'll have a second round of just discussions, but thank you
Yeah,
so much. And to everyone watching, don't forget to like, subscribe, and share the video just to get the word out about the amazing work that PrevMed is pushing. And thank you. Thank you so much, Dr. M.
thank you so much, Sagadi. It was lovely chatting to you.
Of course.
Have a good day.
You too. Bye.
Bye.
Bye.